Hello, it's Annette here. Welcome to my pelvic care course. In today's course, we'll learn how to do a proper Kegel in 7 steps. In yoga, this is what we call Mula Bandha. It is a practice of Kriya Yoga. With these 7 steps, you can begin to know yourself in a new way by creating a new connection between your brain and your pelvic floor. Our body has an intricate design. It has an amazing capacity to heal, so there is hope if you're trying to rebuild your pelvic floor from ground zero. That's if you have no feeling and nothing is working down there, and it is affecting the quality of your life. You've come to the right place. You can start with 1 or 2 elements of the steps, of the 7 steps, and eventually bring them all together, building them 1 step at a time. So how do we find our pelvic floor? Let's start with the bones. In this seated position, just rock your body side to side a few times and feel those bones as they press into your chair or mat. Now, keeping the body still, you can place one hand on your pubic bone and the other hand on your tailbone. We've now just identified a diamond shape using these bony landmarks. If we divide this diamond horizontally, we get 2 triangles. The urogenital triangle is from the pubic bone down to the left and right sitting bone. The anal triangle is from the tailbone at the bottom to the 2 sitting bones at the sides. Together, they form the pelvic diaphragm, which sits within the diamond bone-shaped structure and supports the bladder, intestines, the uterus in women, and also helps with continence functions with the urinary and anal sphincters. You have a lot of muscles that are playing a role in the pelvic floor. We won't talk about what these muscles are for now, but only where we want to contract. Always remember that even as you contract your pelvic floor muscles, the major support muscles of the pelvis, remember your abdomen, back, buttocks, and hips, these larger muscles remain relaxed. Okay, here we go. 7 steps to a better Kegel. 7 steps to help you reconnect the mind to the pelvic floor. I'll name them once and then we'll go over them. Step 1, relax and settle your pelvis. Step 2, meet Romeo and Juliet. Step 3, meet your sitting bones. Step 4, close your urethral sphincter and lift the urogenital triangle. Step 5, squeeze your anal sphincter. Step 6, lift your perineum. Step 7, close and lift your vaginal opening. We'll go over them together now in detail. Step 1, relax and get settled. Find a quiet, peaceful place where you can relax your body and your mind. For instance, you can go outdoors in nature like I am. Or if that's not possible, stay indoors in a quiet room and visualize that you are outside in a beautiful garden. When you're able to relax your mind and body, it's helpful in developing a connection to your pelvic floor. So find a comfortable seat. Sit on a cushion if your hips are tight and your knees are higher than the crest of your pelvis. This will help you align your spine and relax your hips. Rotate your thighs in, back, and apart so that your pelvis tips slightly forward and your low back has its natural curve. If you have tension anywhere, this will become a barrier and prevent you from connecting your brain to the pelvic floor. Now let your spine be tall, rising through your crown. Breathe. Belly is soft. As you exhale, settle your pelvis. Feel your pelvis heavy, descending with gravity onto the earth beneath you. Heavy like a clay flower pot full of earth. Release any other tension in your body. Soften your face, shoulders. Relax your hips. Step 2, meet Romeo and Juliet. Take your tailbone at the back and your pubic bone at the front and draw them toward each other. Romeo and Juliet, star-crossed lovers longing to be together, longing to meet again. Feel the magnetic pull of this subtle activation, this connection from the front to the back. Hold for 3, 2, 1, release. Step 3, meet your sitting bones. Bring your awareness to the sitting bones, left and right. Now squeeze your sitting bones together. Feel the sitting bones drawing toward each other, trying to meet in the middle. The feeling should be uplifting. Hold this for 3, 2, 1, release. Step 4. This involves closing the external urethral sphincter and lifting the urogenital diaphragm. We'll start with the urethral sphincter. This is the little sphincter that holds your pee channel closed. Squeeze your urethral sphincter now. It's a very fine and subtle connection. You would use it to stop the flow of urine. Okay, release. Now we'll work with the urogenital diaphragm. Like I mentioned earlier, this is a triangle of muscles that goes from the pubic bone in a triangle shape down to the sitting bones, and the base of the triangle joins the sitting bones. It's a diaphragm of support for urethra, vagina, and for the bladder. Where you stop the flow of urine, that is the middle of the triangle. When you're contracting, you're feeling it in this triangle, like all 3 points of the triangle are pulling in and up to the center. Visualize this broader triangle support around this area. Bring the 3 points together and upwards. Hold for 3, 2, 1. Release. Step 5. Squeeze and lift your anal sphincter. Focus as if you had to stop yourself from passing gas or having a bowel movement. Reach down with your mind and squeeze and lift your anus. Hold for 3, 2, 1, and release. Step 6. Lift your perineal body. The space between your anus and your vaginal opening is the perineum. And here there is a crossover of muscles, and this is called the perineal body. This is where we placed the ball in the previous video to release your pelvic floor. Bring awareness to the perineal body now with your mind. Grab hold of it and lift it up. Hold for 3, 2, 1, and release. If you have had an episiotomy during a vaginal delivery, the perineum will have been cut either straight or on an angle. In my case, I had an incision that ended up tearing as well. In these cases, your perineum may have a lot of scar tissue and be quite restrictive in movement. Following a surgery, you might not be able to lift it or sense it, and the connection may take longer to restore. Step 7. This involves the vagina. Close your vaginal opening and lift it upwards and inwards. Imagine that you're trying to lift it all the way to the back of your spine. Hold this for 3, 2, 1, and release. This is what most people do as a Kegel, vagina only. However, from what we have learned so far, there are a lot more muscles in the pelvic floor that we can learn to connect to, activate, and release. Do the exercises. Build on each step until you can bring them all together. This will ensure you get the maximum benefit of the most effective Kegel, and this will change your life for the better. You've probably heard that Kegels can help you improve your orgasm. In the next video, we'll learn how to practice to have the best orgasm ever.